for World Hypertension Awareness symbol. We also express our gratitude to all of you, thanking out for valuable time for novel initiative. We also welcome our esteemed speakers for today's session, Dr. Sreenivas Kumar sir, DM Cardiac, and Dr. Bipin Seth sir, DM Endo. For this session, I would like to invite Dr. Sreenivas Kumar sir to start the session. Srinivas, can you mute Surya?
Yeah.
Give me just 1 minute. I'll share my screen.
Yes, sir.
Is it seen now?
Yes, sir. It is visible.
It's visible, sir. You can proceed, sir.
Yeah, good evening, everybody. And I'm very happy this evening to be part of this hypertension BP logo launch in this part of our country, both in Hyderabad and Telangana, I was told. It was done before. It is very important for all of us to understand what is the importance of hypertension, knowing about it, and hypertension awareness, and how to increase that awareness, and how far this new initiative of Denmark of launching a hypertension logo goes. And I'll briefly touch upon these aspects in my coming 10-15 minutes. I'm indeed honored, and I'm very happy to share the same platform in which Dr. Bipin Sethi sir is talking about ACE inhibitors and ARBs and some of the new information in this COVID era. We have very fond remembrances of Dr. Bipin Sethi. He was our teacher. Then a lot of guidance was given during our trainings. Then we practiced together. And for any help we want, sir is always ready to help. And we are also planning to do one FIFA study platform for training for the undergraduate students and postgraduates, in which sir is also part of it. And we should actually thank Glenmark for making this possible, for taking time from Dr. Bipin, and we both talking to each other, and always with all other physicians. It's very apt and very good on part of Glenmark to think of this, because I was always telling them, unless the market leaders in this antihypertensive drugs come forward and do some initiative to increase the awareness of regarding this of hypertension. And I was also talking to them and discussing with them to make somebody as a brand ambassador for creating awareness. I think during this launch, they've also made our ex-captain and highest wicket taker, Dr. Anil Kumble, was made as a brand ambassador to increase the awareness for hypertension. So it is also very apt for us to recapitulate that diabetes, which is again very important, and the maximum number of cases happen, unfortunately, in our country also, is given a lot of importance thanks to all the hard work done by seniors like Bipin, endocrinologists, and various other endocrinologists and physicians, and across the population. And a lot of awareness is created about diabetes, but unfortunately, not even 1/10 of it is given for importance to hypertension. Many of them are the patients themselves. We see complaining that the sugars have gone up to 120, 130, and they report back. And sometimes it could be some negligent patient could be there even in that. But we do see even doctors and doctors' parents themselves having blood pressures of 160, 170. They go on without taking treatment without the various myths, and sometimes they land in trouble. So that is why it is very important. I'm not finding fault with the diabetes getting more credit, but we want hypertension also to have equal importance, and probably more number of patients could be saved if we can manage this entity very well. And if you see, this is unfortunately, as we know, that hypertension patients are increasing. But what bothers us is many of these, 50% of them go not detected. When you do some screening camps anywhere, significant number of patients are newly detected. And recently, from the Cardiology Society of India, also we did one project in which about a significant number of patients, 50% of them were detected new. And those patients who know that they have hypertension also, they don't take treatment. They think that the blood pressure will come down. They'll have various reasons. They will also ascribe some things to corona, epidemic, stress, and all that. but they refuse to take treatment. They don't start taking treatment. For some good patients who are on treatment also, unfortunate thing, both doctors and patients, they did not bother too much about the control of blood pressure. What is the optimal target values which we need to achieve? That is again dismal. So half of them are not detected, out of which half of them are not treated. Out of treated people, again, significant number, about half of them do not have controlled blood pressure. So this is something for us to understand and bother more about it for optimal control of pressure. If you see top 10 global causes of deaths, this is data of 2016, got published in Lancet, basically suggests that ischemic heart disease and stroke. India, no more we see we are communicable diseases like infectious diseases are common. We always have already predominance of non-communicable diseases, and ischemic heart disease and stroke contribute to one third of deaths in our country. And if you see what is the commonest cause which is leading to this, if you analyze, both these entities are significantly contributed by this hypertension. Hypertension. Are you able to hear me? Any problem?
It's clear, sir. You can go ahead.
Absolutely no problems.
Yeah, hypertension is the most important preventable cause of heart disease and stroke worldwide. If you can, you have it, this entity can be easily controlled by giving appropriate tablets, but unfortunately, it is not done. So, if you see, this is the important, most preventable cause of heart disease. If you see commonest risk factors globally for death, which is happening, is the high blood pressure is again the predominant single largest factor for causing highest mortality. About 10% of deaths in the world are happening because of hypertension. And tobacco abuse, infections, diarrheas, other things come later. And this hypertension, which causes both important in the stroke and coronary artery disease, again becomes very important in increasing morbidity and mortality across the country. Global prevalence of hypertension, probably anywhere in the part of the country you see world, you see you pointed, there is always hypertension is there. Be high-income countries like West in USA and other countries. Russia also has a maximum incidence of hypertension somehow, and or the middle or low-income countries, the incidence of hypertension is significant, and about one third of the population is suffering with hypertension. And what is bothering in our country is basically US, they have become more knowledgeable, educated, health education has gone, various measures are being taken. The incidence is not on the rise. But here in our places, the incidence is going up and up. So from 599 million, it has gone up to 1 billion. This data is about of 2010. Must have gone up further. So this is what all of us need to educate masses, and we also need to take it seriously and prevent this further rise of epidemic of hypertension. If you're coming back to specifically hypertension in India, the various studies have estimated that hypertension prevalence in India is about 29.8 in one of the study. That means one third of population, if it is hypertensive, that is 40 crore Indians would be hypertensive. So if you see how much is the dialysis that is attributable loss of years because of this, the hypertension increased from again 21 million to 39 million in 2016. This is 89%. This is what not only the higher percentages of population which is getting affected, and the further increasing numbers and losses because of hypertension is what is bothering more and more. If you see the map of India, all across the country, probably the maximum incidence is somehow noted in Punjab and Haryana because of obesity and various other factors. And then both in men and women, it happens. Hyderabad is somewhere in between. Unlike diabetes, I think where Hyderabad dominates more, here some of those two countries or states are more. If you see the screening studies of India, what is other thing which is important all of us to understand is, that's how I think you can simulate now. I am talking with Dr. Bipin, there's diabetes and hypertension go together. So these are basically twin epidemics and have together they cause more worrisome, more damage to patients. 15,662 eligible patients when they were studied, and out of this 46 had hypertension, but about 20% of them also had both hypertension and diabetes. So this is when this becomes combination together, then it becomes more worrisome. Other statistics also show a significant number of patients who have borderline blood pressures, what is called as pre-hypertension before. That's how they were also having higher risk, and blood pressure levels are cut off is lower to 130/80 now. And a lot of them, significant number of patients were also in the borderline ranges of 120 to 140. So the pre-hypertension also needs to be taken into account. And now we call it as a hypertension stage 1 itself once it crosses 130. And if you see the number of people in any country, if you see it, sheer numbers in India and China, because our population is huge, the number of individuals who suffer with in millions becomes very, very high compared to all other parts of the world, which are all smaller countries with small number of population. That's how it is very important to control the hypertension both in India and China. Let us now see some particular states. What is the status? Tamil Nadu, Jharkhand, Chandigarh, Maharashtra are mentioned here. This is what is said. Some known, self-reported is already known hypertensive. But when you detect by a study, this is a newly diagnosed ones. Always double the already known subgroups of patients who have hypertension. So obviously, the incidence of hypertension in urban subsets is more compared to rural. But rural things are also gradually catching up. I think which we need to act on it and to prevent further increase even in rural subsets here. So, and also the awareness and should be increased regarding hypertension to prevent this discrepancy. And if the more number of patients are detected, probably more will come on to treatment. Urban hypertensives ranged from 28 to 31%, and rural hypertensives were about 20%. And the rural India is also gradually catching up because of increasing changing lifestyle even in rural India. Then, if you see what age groups of 15 to 49 years of age groups were studied here, and all the states together, if you see the screened population, aware population, again, the half rules is again shown here. Out of the total number of population percentage which have only appropriately treated controlled blood pressure patients are only 8% of the total. This is what is bothering us. It is not very difficult also to treat hypertensive patients properly, provided we take it seriously and treat them appropriately. This global disability adjusted life years, the DALI is what we call by systolic blood pressure, and the countries and various places in the world, India stands somewhere in between here. And that's how it is very important to both India and China. If you can control this, then significant loss of these problems could be avoided. If you see deaths and DALIs due to hypertension, again, in India, because the number being more 17.3, significant numbers are again getting affected because of hypertension. And the Russia also somehow has very huge population hypertension burden, unlike other diabetes in Russia. Repercussions of uncontrolled hypertension is not only day-to-day life problems. If coronary artery disease, at least suddenly they have some problem, either die or become all right. But if they get into stroke, a lot of them get into this sort of troubles where 93% of them need help in day-to-day activities and moving around and even for eating. So they become dependent. And once a stroke happens, it is very ghastly. We all know how bad is a stroke if it happens in these individuals. So prevalence is increasing in rural India. That's what I mentioned already. But another thing which is bothering us is also prevalence is increasing. And many of these young people, especially software professionals, other things who are because of a changing lifestyle and stress in their work levels, younger people are also becoming hypertensive. If you study the various studies which are quoted here from the various other countries and Rao et al. And other groups also, about 12 to 17% of the population, younger population, are also landing into hypertension. So if you see, again, stretching it further, this is a study conducted by Anita Saxena, Madam Professor of Cardiology in All India Institute in Delhi. And they said every 2 in 10 school children are having hypertension. I was also surprised seeing this. So every 2 in 10 is very alarming. And probably because we use the same cutoffs normally for 140/90, which is not correct for children, then we miss out a lot of the school children who will be having hypertension. So if you create awareness, then probably right from the school age group, awareness should be created. And we should all take this entity seriously rather than writing it off. And how much importance is given to cancer, not even 1/10 of it is given to this problem. So if you see what is it causing, economic burdens, if you see the loss of hypertensives once they lose their jobs and the economic burdens on the country, significantly, if compared to all other entities, it leads to a lot of significant problems, economic losses in trillions. This is what is mentioned is 2.1 trillions. Then awareness, again, though it is there, but it's much, much less. Rural population behave further worse. And because the rural population is also increasing, it is better for all of us to increase awareness somewhere, even masses. Somebody who is not educated also, if he sees something, he should become aware of this problem. And other problem which many of the people have misconceptions is they don't have any symptoms. Why would they get hypertension? As you need to create this awareness, but 90% of them could be asymptomatic. And other beauty of blood pressure control is, again, even if 2 millimeter blood pressure reduction, which looks very funny, 2 millimeters blood pressure reduction of systolic could decrease 10% stroke mortality and 7% mortality decrease in IHD. So whatever tablet, be it be Telma or be it be whatever tablet you give, if you can decrease blood pressure a little, also it goes a long way in preventing problems to this patient. This is because we may think 2 mm as a value, but 2 into each number of beats for the heart, and then that into number of minutes, into hours, to days, into years, that becomes a huge reduction of stress on the human body, vasculature, heart, and brain. That's how significant stroke mortality decreases. So apart from coming to the therapy of hypertension, if you see, lifestyle changes are become very important. And then we also need to make them aware that to prevent the complications is becoming very important. So we all now realize that hypertension is a major public health problem, and the incidence is rising in India, both in urban and rural India. Incidence is also rising in younger population. So if you see what is hypertension causing, to summarize before we go on to the logo, is it is killing to 9 to 10% of all deaths in our country. And 4.6% of all daily losses is happening because of this. Hypertension accounts to how much? 16% of all coronary artery disease patients, and 21% of all peripheral vascular disease patients, and about 124% of all acute myocardial infarctions, and 29% of strokes, and about heart failures, 50%, that figure is missing. About 50% of the heart failures could be prevented if appropriately controlling the blood pressure. So even many of us won't think it causes so much of havoc. Then if it does, critics always say by doing such programs, improving awareness, does it really benefit? So that was also scientifically studied. And if you increase the awareness of a population, 5%, that is reduction of unaware hypertensives by 5%. To other way, increase the awareness by 5%. The decreasing in events will be 1.55 events per 1 lakh persons per year. If you double it, 10% population unaware becomes aware, 3.1 events per 1 lakh person years could be prevented. And again, it becomes more if it's 15% reduction of unaware population happens, 6.2 events could be prevented. So much of strokes, so much of heart attacks could be prevented just by increasing the awareness. And the awareness in turn leads to proper treatment and proper control. So in Indian government, especially even the ICMR, under the leadership of Professor Balgam Bhargava, who is a cardiologist himself, launched this good initiative of Hypertension India Control Initiative. And they selected about 35 districts, and they want to expand this to 100 districts in the country. So what they intend to do is increase the blood pressure control from the present value of 10% to something like at least 30% initially in these districts by 2022. So how are they planning to do this? Basically to increase the awareness and the standard treatment algorithms to be given. And all these drugs which are required should be made available more freely. And the BP measurements also should be, and checking and the giving tablets should be decentralized by multipurpose health workers and other measures which are broad population level. So if this can happen significantly, then the same things can be spread across the country throughout. So if we achieve this goal by 2022, then probably more benefit can happen to the country. The partners of it is ICMR, WHO, and state governments, and obviously many of these industrial colleagues like Glenmark, other things should also take initiatives and help in this India hypertension control. So adequate supply of blood medicines and the blood pressure monitors. Now measurements have also become simplified, and machines have also become simple. And but only thing what we lack is the team-based approach and counseling by various paramedical workers, and regular follow-up of these patients. Once the patient's blood pressure tend to get controlled, they tend to ignore and stop taking treatment. That's where we need to educate them, and providing the medicines regularly every month or once in 3 months goes again help to maintain the control. Then this is in general. Then what we are planning to do is early initiation, reduce the risk and decrease the disease burden, improving the adherence. That is what is required. So towards this, what we are planning here to discuss is this launch of a logo for hypertension to increase the awareness. So we know of this pink ribbons, and we also know the blue circle. Many of you may not be aware of it already. It is working for diabetes, and we also have logos for HIV/AIDS. And a lot of good things have happened in the society by increasing the awareness. But as of now, such a ghastly problem of hypertension did not have anything like that. This breast cancer, somebody sees this pink ribbon, they always know that it is related to breast cancer. This diabetes, blue circle is universal symbol of diabetes, and again, it creates awareness of diabetes. Now, when many of us and even the companies, pharma, others were discussing, no, why no symbol is there at least till January 2020. That's how I think Association of Physicians of India, Hypertension Society of India, and in principle, many of the cardiologists, the Cardiological Society of India also will agree. And all the companies, everybody together, if it has done, it would have been better, but it's very difficult for it to happen. So this logo is created. This is world's first hypertension awareness symbol. And it's quite easy for us to understand here. They have selected various types. I would come to that. So it incorporates automatically BP and then this manometry, which pressure shows the pressure recordings there. The two T alphabets there are B, blood pressure. An infinity logo again should be indicating the limitless benefits of controlling blood pressure. And blue color, there's right side deoxygenated blood, left side oxygenated blood also is made colorful and also has some meaning in it. And below is written the most important: control your blood pressure. So this BP dial also makes us to imply and call into action for controlling this blood pressure. I think this logo is very apt to create and self-explanatory, I would say, and putting it in various places across would go a long way. We should congratulate Madhukar Raju, who designed this logo, and we should also congratulate Glenmark for taking this initiative. So this was actually thought of, and they started collecting information from all the doctors. I was told cardiologists in particular, or many other physicians, endocrinologists together, and 50,000 doctors' opinion were taken by the Glenmark team. And these are the three logos in which it was initially considered. And what came out of winner is what is selected is about 48% of the doctors preferred this. And that's how World Hypertension Awareness logo is created. Initially launched in API. Now we launched sometime back in Mumbai, and now it's virtual actually. It's no place that everywhere it can happen. I'm very happy that Glenmark is doing this in Hyderabad and Telangana and the Andhra Pradesh areas. And we wish this message spreads across and more people will realize the importance of hypertension and put patients on treatment of hypertension and control it and prevent the target organ damage and further problems. In the end, in the discussion, if time permits, I would stress some of the important aspects of a large trial of BP reduction. Trial is data of 320,000 patients presented in European Society of Cardiology day before. I think we can have some discussion on it. Thank you
Yes.
again for all for patience.
So thank you, sir, for insightful presentation and current situation.